what's being called a superstorm tonight.
Sandy is pounding the Bahamas this morning, and by next week it could bring hurricane-force winds to the northeastern U.S.
If it hits at the maximum tide, then we are in bad trouble.
The East Coast is being pummeled with the power of a record-breaking superstorm.
Oh my God, it's washing everything away!
The level of devastation at the Jersey Shore is unthinkable. You look to your right and to your left, to your husband or wife, your son or your daughter, right? Those are the things that can't be replaced.
And seeing half of that pier is gone, and that then you see a roller coaster that just a few months earlier you were on that same pier with your kids and going on those rides. I mean, it's just, your heart just goes through the bottom. Prior to Sandy hitting Ocean County and making landfall here, we were staging assets and getting them ready and moving them around.
We knew this was going to end up being a shelter because we knew the numbers would be bigger than what they were expecting.
I had traveled around to each of the county shelters that were being set up, just make communication and face-to-face contact, and really trying to get that going and getting that set up. During the event, there's a lot of kind of waiting. I mean, you really don't know the impact.
That night, I thought I was going to be dead.
The house was completely engulfed in water. And I said to my wife right at that moment, we have to leave, and we have to leave right now.
That evening of the hurricane, I think we had 480 individuals in this building here. I didn't leave this facility for a good week and a half.
And at the height of the storm, we had actually sheltered over 500 people from Ocean County, which was tremendous work, and also over 200 pets that these folks owned.
And I have my 3 dogs with me. I mean, they're like my family. That's it.
That became a great comforting source for the residents, because then they could be with their pets.
When you're looking at crafting your plan and moving ahead from a public health perspective, there's so many needs that really are out there. Food safety, water safety, and personal health safety.
It also affects just the mental health of individuals. Some of our national partners, our federal partners reached out to me and talked about that experience, that they had seen an uptick in both domestic violence as well as in child abuse from Katrina. And so I coordinated with my sister agencies, the Department of Human Services and the Department of Children and Families, and we were able to coordinate and focus our collective response to help support both parents and children as they were going through this really stressful time.
Public health is more than managing a response plan on paper. It's about understanding a community and serving people's basic human needs. When faced with the worst, we learn just how ready we are. The Robert Wood Johnson Foundation community is inspired by our colleagues in public health. There are many like them all around the country doing this important work every single day, and we're proud to stand with them in improving the health of all Americans.